Welcome to the Disaster Behavioral Health Just-in-Time training. My name is Stephanie Waite, and I am the Disaster Behavioral Health Coordinator with the Office of Emergency Management at the Department of Behavioral Health and Developmental Services. This training will prepare volunteers to provide disaster behavioral health services to shelter residents who have evacuated their communities for health and safety reasons. This training is applicable to anyone who staffs and supports shelter operations in Virginia. You do not have to be a mental health clinician or emergency management professional to provide disaster behavioral health support to shelter residents. We are going to talk about what kinds of events may bring evacuees to shelters, what their reactions may be, and how you can help them. Let's get started by reviewing our objectives. First, we are going to develop a general understanding of the shelter environment and the role of the behavioral health support volunteer. We will then develop an understanding of disaster reactions. And finally, we'll gain an understanding of the three-pronged approach to supporting shelter residents. First and foremost, thank you for volunteering your time to assist Virginians during disasters. Your role as a behavioral health support volunteer is simply to help make what may be the worst day for an evacuee more bearable by being present and listening. As you consider volunteering for an emergency shelter, remember that listening to those you encounter is likely the greatest act of kindness that you can offer. When people are evacuated to a shelter, it is most likely because there is an emergency or disaster that makes it necessary for families and even the community at large to leave their homes. There is a likelihood that the conditions in the affected areas will render the community uninhabitable for an unknown period of time. Evacuees may express uncertainty, fear, and anguish regarding their family home, community, and what they face in the coming days, weeks, months, and sometimes years ahead. While the task of providing support to shelter residents may seem daunting, the solution is quite simple. Virginia is at risk of impacts of multiple hazards, including hurricanes, flooding, tornadoes, long-term power outages, and other events that could create the need for shelter operations. While most weather-related events, such as hurricanes, can be forecasted several days in advance, others, such as tornadoes, may only be indicated by meteorologists a few hours or even minutes in advance of the event. When major hurricanes are predicted, and there's indications of major flooding, high winds, downed trees, or power lines, the state or local government may order mandatory evacuations for the safety of residents in the affected area. When a disaster strikes, a locality will open a local shelter in places like churches or public schools. A state-coordinated shelter is only opened when a disaster is so great that a locality does not have the resources or capacity to meet the needs of the affected areas, like a major hurricane coming towards a heavily populated area. State-coordinated shelters operations are conducted outside of impact areas. For example, when a weather system impacts the eastern part of Virginia, a shelter at Virginia Commonwealth University in Richmond, Virginia may be opened. Institutions of higher education provide the locations for shelters where evacuees can be housed until it is safe to return to their community. Shelter locations must be large enough to house both evacuees and those working to provide services such as food, medical, and disaster recovery information and support. Let's now talk about some of the disaster reactions that you may see. First, it is important to remember that people are extremely resilient and typically move through the recovery process following a disaster without intervention. Second, shelters are staffed with behavioral health professionals that have experience providing crisis intervention to those that may need additional assistance to cope. Let's talk about the kinds of disaster reactions you can expect to see in a shelter environment. You may meet people in the shelter who have lost their homes entirely or cannot locate their families. Shelter residents may seem disoriented or confused. This is typical after acute trauma. They may lack a sense of time or place. Shock is also typical following a disaster. Sometimes people have a hard time expressing their needs when they are in shock. Uncertainty about the future, the status or whereabouts of family members, as well as the ongoing event, may predictably elicit fear responses. Some may cope with trauma by keeping themselves in motion. Whereas some may seem unable to communicate because of shock, others may not be able to remain still or appear hyper. People may feel that staying busy is the best way to cope with their current circumstances. You may see those that seem angry or irritable. It's normal for people to not feel like eating or sleeping during a crisis, and this is partially due to the body's natural ability to adapt to uncertainty and sudden trauma or stress. These physical conditions, paired with grief, can certainly cause anger and irritability. All of these jolts of adrenaline, lack of sleep or proper diet, shock and trauma can likewise bring about fatigue, and people may express that they feel numb. Trauma affects everyone in different ways. Everyone is different, and every body is different. Response to trauma is manifested in many ways. This may be due to life experiences or their degree of wellness prior to the event. This is why it is important to have a cadre of volunteers with varied backgrounds and lived experiences. However shelter residents manifest trauma, it will be your task to provide brief, compassionate, and resiliency-based interventions. Let's break down how you can do that in 3 simple steps. As mentioned previously, behavioral health professionals will be on site to provide crisis intervention should the need arise. Your role is to be kind, present, and listen to people who've just gone through a traumatic experience and help cope over the duration of your shift. There are 3 simple steps to keep in mind when engaging with shelter residents. Stop, listen, and validate. Shelter operations are very busy with staff providing the services we've talked about earlier, such as registration, meals, medical treatment, and other life-sustaining necessities. You will likely be tasked with assisting in some of these operations, such as handing out water or blankets, for example. This is how behavioral health support is generally delivered to shelter residents. While there will be an area in the shelter for those who need more in-depth support, most behavioral health services are provided while offering comfort items. When doing this, be prepared to stop if you see anyone who may be experiencing the disaster reactions we've talked about. For example, if while passing out water to residents, you observe someone visibly trembling. In this scenario, it's appropriate to stop what you are doing and ask this person if they are cold and offer them a blanket. Introduce yourself. Let them know if or where hot beverages may be if they are available. If they indicate they have a medical condition, then you can walk them over to speak with medical professionals. No matter the reason for the behavior that you observe, the important thing to note here is that once you observe it, you should stop and inquire as to how you may be able to help. It is at this point that a person may begin to discuss their experience or what they are feeling with you. Letting them know that you are there to listen can make a huge difference in the way they view their situation and their circumstances. And that takes us to step 2, listen. As we discussed previously, every body and every person is different. Some people may want to share their feelings, and others may want to find out information about how they can seek financial support or check on family and friends. In any case, you should listen to determine the need. Prior to your shift, you will be briefed on the location within the shelter where this additional information can be found so that you may direct people to the right place. Otherwise, listen and let the person know you are fully engaged. You will not be able to resolve the symptoms of the trauma they have undergone, so it's important that you manage your expectations as well. People's emotions are as fluid as the event itself, and it will be your job to simply validate their reactions as they are presented to you. Remember, you don't have to have all the answers, and you will have the support of professional shelter staff. Step 3, validate. Let's briefly return to our scenario. You have offered water to a shelter resident who is visibly trembling and upset, and you have been listening to their story and the expressions of fear and anxiety. Let them know that it is not unusual for people to be afraid and anxious after a traumatic event. It's also okay to express your sympathy for their experience and/or grief by saying, "I'm sorry for your loss," or "I'm sorry, I realize this is understandably a difficult time for you." We can validate a person's reactions by saying things like, "What you are feeling is not uncommon." While disaster reactions people express may be considered normal among those in the field of disaster behavioral health or emergency management, it is new and anything but normal to the person you are speaking to. That is why it's a better idea to offer validation such as, "What you are feeling is not uncommon," or "It's understandable to be upset, anxious," rather than tell them that it is normal to feel that way. Grounding techniques are simply ways of showing or explaining ways to calm people's physiological response to trauma by bringing them to the present moment. If you are comfortable doing so, you can ask if they would like to take a few breaths with you. Counting the lengths of inhales and exhales can slow the nervous system and can help reduce anxiety. If you observe people that seem confused or disoriented, it's perfectly fine to remind them where they are, that they are currently in a safe place, and that you, as well as others, are here to help them. This can help reassure people that while the trauma they endured was very recent, they have survived and they are now in a safe space. Those are the 3 steps to providing disaster behavioral health support. Let's discuss a couple of do's and don'ts that may also be helpful as well. Do. Listen twice as often as you speak. Give those you encounter your full attention. Keep good eye contact. There may be a lot going on around you, but it is important to really focus on the person in front of you. They may have concerns that they have not yet fully addressed, and your active listening will help you point them in the right direction should they need additional resources or information. Introduce yourself. This really helps develop rapport with people. Asking their name reaffirms that you are genuinely there to support them, and calling them by name can be a subtle affirmation of that. Ask if there are any comfort items that you may offer, such as food, beverage, or a blanket. And finally, ask questions. Make sure that you have a good understanding of the different services that are provided in the shelter so that you can easily and quickly help people get the information or services that they need. You will be briefed upon starting your shift by a shelter staff member. Make sure after this briefing you know where items such as food, blankets, and medical staff are located. There may be a children's area or quiet space for those who need it. Knowing exactly how to direct people to these things can really help mitigate the chaotic nature of the event for the evacuee. And for the don'ts. Don't say you understand. Remember, every person and every body is different, and it's important that people feel validated and supported. Don't tell someone to calm down. It's okay to show them how to calm down if that is appropriate, as we talked about earlier with breathing exercises, for example. If quiet space is available, perhaps you offer that as a way to distance the person from the general noise of the shelter. Don't make promises. Don't promise information you cannot deliver or possibly know. For example, don't try to answer questions like, "Where are my family and friends?" or "Why did this happen to me?" Or tell people that everything's going to be okay. Things being okay or all right is relative, right? As we talked about previously, we all come to disasters with different pre-disaster functioning and adaptability. And finally, don't diagnose. People may ask things like, "Why can't I stop shaking or trembling?" or say things like, "I don't get any sleep here." You can respond by saying, "These feelings are not unusual considering what you've been through. A lot of people have difficulty sleeping or concentrating." Disaster behavioral health is about listening and validating individual experiences in the moment. There is no way for us to know how the people we encounter in an emergency shelter will recover because our work happens in the direct aftermath of a disaster. This brings us to our next discussion on when to refer people to those professionals available in the shelter. Before we talk about when to refer shelter residents, let's pause for a brief knowledge check. True or false? Everyone who comes to shelter should receive a mental health evaluation. This is false. People are extremely resilient and typically move through the disaster recovery process without intervention. Next, true or false? If you see someone weeping while you are offering blankets to shelter residents, you should just finish what you are doing and come back to them later. False. If you observe a person experiencing any of the disaster reactions we have discussed, you should stop, introduce yourself, and prepare to listen and learn how you may be able to assist them. If after speaking with a shelter resident, you feel that what you may have seen or heard may be more than disaster reactions, there are two ways that you can get assistance. 1. Ask if they would like to speak to a medical provider or counselor. This may not be the first time you offer this during your engagement with the resident, and they may decline, but offering resources is a great way to wrap up the time that you have spent with them. Let someone know your concerns. You will be assigned a member of shelter staff to report to upon arrival and departure, and this person is a good resource with whom you can address your concern. And 3, shelter staff are trained with emergency management professionals, and depending on the size and scope of the disaster, there may be other resources available such as emergency funding for housing, food, or personal property. Let's wrap up by reviewing a few key points to remember. First, most people are naturally resilient and do not require clinical intervention following a disaster. While many of the disaster reactions we have discussed are similar to those often described in clinical behavioral health settings, it's important to remember the context in which we are observing these reactions. We approach disaster behavioral health support with the understanding that the people we meet are going through a traumatic ordeal and disaster reactions are not uncommon. Second, every person and every body is different. Manifestations of stress and trauma look different depending on a person's previous experience with trauma or disasters and the degree of wellness prior to disasters, among other things. Remember that disasters are fluid events, and the answers to questions about the event are also fluid. It's impossible to predict what an individual's road to recovery will look like. Your task as a behavioral health support volunteer will be to listen, validate, and refer when necessary. For more information about disaster behavioral health services, you can visit the National Child Traumatic Stress Network website and take psychological first aid online at no cost. The Substance Abuse and Mental Health Administration, or SAMHSA, also has a Disaster Technical Assistance Center online that provides a variety of resources regarding disaster behavioral health services. Thank you for your willingness to be there for others on what may be their worst day. We hope that should the need arise, you find your volunteer experience to be fulfilling. If you have any questions or would like more information about disaster behavioral health in Virginia, please feel free to contact me at 804-516-1778 or at stephanie.waite@dbhds.virginia.gov. Thank you.